You know, hair loss is a huge deal for millions of people. But let's be honest, the most common treatments can come with side effects that are just as worrying as losing your hair in the first place. So today, we're going to break down a really fascinating clinical trial that looks at a potential game changer in this fight. Let's jump right in. And that really is the million-dollar question, isn't it? It's the dilemma that so many people face. Is it possible to get the hair you want without messing with the rest of your body? Well, this is the exact question that a group of researchers set out to answer. All right, first things first, let's get on the same page with our terms. We're talking about androgenetic alopecia, or AGA. You probably just know it as male pattern baldness. And this isn't some rare thing. As the study points out, we're talking about a hereditary condition that hits at least half of all men by the time they're 50. That's a huge number. So, for a long, long time, the gold standard treatment has been a little daily pill. That pill contains something called finasteride. Its whole job is to stop testosterone from turning into another hormone, DHT, which is basically the main villain that shrinks hair follicles. Sounds simple, right? Block the bad guy, save the hair. But yeah, there's a pretty big catch. And this is that catch. See, when you swallow that pill, the drug doesn't just go to your scalp. No, it goes everywhere, throughout your whole system. And what tons of studies have shown is that this can lead to some really, really unwelcome side effects. We're talking about serious stuff like decreased libido, erectile dysfunction, and even mood changes like anxiety or depression. For a lot of guys, that's just a deal breaker. So naturally, all these potential side effects got researchers thinking, and it led them to a super logical question. Hey, what if instead of this systemic whole body approach with a pill, we could just deliver the medicine directly to the scalp? Go straight to the source of the problem. And that one question is exactly what this whole clinical trial is about. Researchers set up a study to put the old school oral pill and this new topical idea in a direct head-to-head competition to see what happens. Okay, so here's how they did it, and this is really the key part. They had two groups. Group A, they got the standard stuff, topical minoxidil, which is a common hair growth stimulant, plus the regular 1 milligram finasteride pill. But Group B, they got that same minoxidil, but, and here's the twist, instead of a pill, they got a topical finasteride solution that they applied right to their scalp. And listen, this wasn't just some casual experiment. They set this up to be super legit. 50 guys with AGA, all between 18 and 45 years old, were randomly split into the two groups. And here's the really important part, it was double-blinded. That means nobody, not the patients, not even the doctors, knew who was getting what. That's huge for avoiding bias. And they followed everyone for a whole year. All right, so a full year goes by, time for the big reveal. Which treatment actually worked better for improving hair density? Was it the classic pill, or could this new topical solution actually keep up? Okay, now check this out, because the results were, well, they were not what you might expect. This wasn't even a close call. The topical group, that's Group B, actually had a higher percentage of people who saw clinical improvement. We're talking 83% of the guys in the topical group saw good improvement, compared to just 65% in the oral pill group. So the new topical stuff wasn't just as good as the pill, it was actually better. And you don't just have to take the numbers' word for it. Look at these pictures. On the left, you've got results from the oral pill group, and on the right, the topical solution group. You can see both groups got results, for sure, but the photos really back up the data. The topical group just had some fantastic outcomes. Okay, so point one, the topical solution works. In fact, it works great. But that was only half the story, right? The entire reason they did this study was to see if it could work without those scary side effects. So how did the two groups stack up there? And this right here is probably the most important slide of the whole explainer. I mean, look at this. The difference is just, it's night and day. Take a look at Group A, the pill takers. You see reports of erectile dysfunction, loss of libido, anxiety, you name it. Now, look over at Group B, the topical group. For every single one of those systemic issues, the number is a big, fat 0. I just want to let that sink in for a second. 0%. Not a single person in the topical finasteride group reported any of the sexual side effects that everyone worries about with the oral medication. That is a massive, massive deal in this field. Now, does that mean the topical treatment was perfect? Not quite. A few people did report some minor stuff, but it was all right there on the scalp. Things like some itching or a little bit of redness where they applied the solution. Minor league stuff, and nothing like the body-wide problems people saw with the pill. So what's the bottom line here? What does this all add up to? Well, the study came to a really, really powerful conclusion about how we should think about treating hair loss. Honestly, I think the researchers who ran the study put it perfectly. Their conclusion was that the results strongly support using topical finasteride. But here's the knockout punch. They said this new way may obviate the need of taking long-term oral finasteride. Obviate the need, that's science talk for, it could make the pill unnecessary. And that leaves us with a really exciting question to think about. What this study points to is a future where you don't have to choose between your hair and your health. A future where the best and most effective treatment might be something you put on your head, not something you have to put inside your body.